Cardiologist alerts. This sleeping position increases stroke risk overnight. The way you sleep tonight could quietly elevate your risk of a stroke by morning. Cardiologists are sounding an alarm, pointing to a common sleeping position that may significantly restrict blood flow and place undue pressure on your heart. Understanding what to avoid before drifting off to sleep is paramount for your well-being. A particularly concerning position to reconsider is sleeping on your right side. While it might feel comfortable and natural in the moment, this posture can subtly impede the flow of blood to your heart throughout the night. This is a serious concern, especially considering that a significant portion of strokes, roughly 30%, occur during the early morning hours between midnight and 6 a.m. These events are not tied to daytime stress, but happen during the seemingly peaceful state of sleep. As a cardiac surgeon, the statistics surrounding these nocturnal strokes are particularly alarming. The subsequent discussion will delve into 5 sleep positions, ranked from least to most detrimental, offering insights into how your nightly rest could be impacting your cardiovascular health. More importantly, it will highlight 2 specific sleep positions that are scientifically proven to actively protect your brain. To begin this exploration, consider your own sleeping habits. Are you primarily a back sleeper, a side sleeper, or a stomach sleeper? Within the next minute, you'll discover if your preferred sleeping style is among those that warrant attention. For individuals over the age of 60, the information presented is not merely advisory. It becomes an essential aspect of health maintenance. Let us start with position number 5, sleeping completely flat on your back without any elevation. While this position often feels natural and promotes spinal alignment for many, especially those who advocate for its benefits, the physiological reality for your body when lying completely horizontal can be quite different, particularly after the age of 60. In this position, gravity does not assist in blood flow. Instead, it works against your circulatory system, causing blood to pool towards your head. In your younger years, your blood vessels possess a flexibility that can readily accommodate this shift. However, as you age, these vessels naturally stiffen, and the delicate arteries within your brain become more fragile. When blood accumulates in your head for an extended period, the pressure within your skull can build significantly. That throbbing headache experienced in the dead of night is not a random occurrence. It is often a manifestation of increased intracranial pressure, where your brain is being compressed by excess blood volume that cannot drain effectively. Research published in the Journal of Clinical Sleep Medicine has substantiated this phenomenon, indicating that even a modest 15-degree elevation of the head can dramatically reduce this pressure and enhance blood flow back to the heart. A common consequence that many overlook is waking up with dizziness, feeling lightheaded upon sitting up too quickly. This sensation, often dismissed as a normal part of aging, is actually a critical warning sign that your body's blood flow dynamics during sleep are not functioning optimally. The solution to this issue is surprisingly simple, and it will be detailed later. Moving on to number 4, we find a position that often surprises people: sleeping on your right side, especially if you have a history of heart conditions or high blood pressure. This recommendation might seem specific, but the underlying anatomy explains its significance. Your heart is situated slightly to the left of the center of your chest. When you lie on your right side, your body's weight shifts, leading to the compression of the inferior vena cava, one of the largest veins in your body. This crucial vein is responsible for returning deoxygenated blood from your entire lower body back to your heart. Even slight compression means your heart must exert more effort to draw this blood back. While this may not be a significant issue for a healthy 30-year-old, for someone over 60 with compromised heart function or elevated blood pressure, their heart is already working under considerable strain. Adding an additional workload for 7 hours every single night can have serious repercussions. Cardiologists have observed a natural tendency among patients with heart failure to avoid sleeping on their right side, as it feels inherently uncomfortable, a clear indication that their body is signaling an issue. Studies, such as those published in the European Journal of Heart Failure, have linked left-side sleeping to more stable blood flow and reduced cardiac strain during sleep in patients with heart conditions. Consider a scenario where an individual has managed their blood pressure effectively for years with stable medication. However, if they consistently sleep on their right side each night, their heart, though not exhibiting overt symptoms during the day, is compensating and working harder than it should, night after night, for decades. This cumulative stress may not manifest in daytime blood pressure readings, but can tragically culminate in a stroke in the early morning hours. If you identified yourself as a right-side sleeper earlier, continue. Listening as position number 3 could also be relevant to your habits. At number 3, we address the practice of using 2, 3, or even 4 pillows stacked beneath your head. Many individuals resort to this to alleviate issues such as breathing difficulties, acid reflux, or sinus congestion, and while some degree of elevation can be beneficial, excessive height creates a detrimental forward bend in the neck. This extreme forward flexion can compress the vertebral arteries, which run along either side of the cervical spine. These arteries are vital for supplying blood to the brainstem and cerebellum, the areas responsible for balance, coordination, and consciousness. Chronic compression of these arteries due to an overly bent neck for 8 hours each night can lead to a reduction in oxygen delivery to these critical brain regions. The stiff neck and dull ache at the base of your skull that many experience upon waking are not simply due to muscle tension. They are often a direct result of restricted blood flow. Research published in the Journal of Manipulative and Physiological Therapeutics has demonstrated a measurable decrease in vertebral artery blood flow with extreme forward neck bending. While this study may not have specifically focused on sleep, the principle remains the same. A compromised neck position for an extended duration nightly has cumulative consequences. A common pattern observed is individuals who consistently wake with neck pain and headaches, attributing them to stress or age, only to find complete relief within a week by simply switching to a single, appropriately contoured pillow. Ranked at number 2 is the tightly curled fetal position, a posture frequently adopted, particularly by older adults, as it is perceived to be protective and safe. However, from a physiological standpoint, this position presents 2 significant problems. Firstly, it restricts the full expansion of the lungs. When you curl up with your knees drawn to your chest and your chin tucked down, your rib cage becomes compressed, resulting in shallower breaths throughout the night. The feeling of being unable to take a deep breath immediately upon waking, a tightness in the chest, is often a consequence of prolonged lung restriction. A decrease in oxygen intake, even by a modest 10 to 15%, leads to reduced blood oxygen saturation. For individuals with cardiovascular issues or early-stage lung disease, this diminished oxygenation places additional stress on both the heart and the brain. Secondly, this position maintains constant tension in the neck and upper back, keeping muscles contracted. This prolonged muscle contraction can compress the small blood vessels in the cervical spine and at the base of the skull, further reducing blood flow to the brain. Studies, such as those found in respiratory physiology and neurobiology, have shown that body positions involving significant spinal flexion decrease tidal volume, the amount of air inhaled per breath, over an entire night. This cumulative effect of hundreds of shallow breaths can lead to waking up with a feeling of fogginess, a dull headache, or mild dizziness, which is often misinterpreted as poor sleep quality, when in reality, the brain has been oxygen deprived for hours. Finally, at number 1, we have a habit that combines multiple risk factors into a singularly dangerous nightly routine: going to bed within 2 hours of consuming a large meal or drinking alcohol. This is a behavior that resonates with many due to social and lifestyle norms, but from a cardiovascular perspective, it represents the most perilous combination on this list. When you consume a substantial meal, your body diverts a significant amount of blood flow to your digestive system. While this is a normal physiological response, it means less blood is available for your brain, heart, and other vital organs. In younger individuals, the body typically compensates effectively. However, in older adults with narrowed arteries, this redistribution of blood can trigger symptoms like dizziness, lightheadedness, and even fainting during sleep. The addition of alcohol exacerbates this situation. Alcohol causes blood vessels to dilate, leading to a sudden drop in blood pressure. For someone with healthy, elastic blood vessels, this might induce a feeling of relaxation, but for seniors with plaque buildup or stiff arteries, this abrupt drop in blood pressure can prompt a compensatory surge, leading to wild fluctuations that strain the vascular walls of weakened vessels, potentially causing rupture. Furthermore, in areas where blood flow becomes erratic, blood clots can form, all while you are unconscious and unable to respond. Research from the American Journal of Hypertension has demonstrated that even moderate alcohol consumption close to bedtime disrupts the natural dip in blood pressure that should occur during sleep. When this nocturnal blood pressure regulation is impaired, the strain on the cardiovascular system increases dramatically. Imagine this scenario: finishing dinner at 8 p.m., having 2 glasses of wine, and going to bed at 10 p.m. By 2 a.m., you might wake with a pounding headache, a racing heart, and sweating, dismissing it as a bad dream. In reality, this could be a circulatory crisis your body is struggling to manage. Over time, these episodes accumulate, leading to small vessel damage and microstrokes that go unnoticed. Eventually, these cumulative effects can lead to a more significant event. If there is one habit to change immediately based on this information, it is this one. Aim to finish your last meal at least 3 hours before bedtime and cease alcohol consumption 4 to 5 hours before sleep. Incorporating a simple 15-minute walk after dinner can significantly reduce your overnight stroke risk, sometimes more effectively than medication. Now, having addressed the positions and habits to avoid, let us focus on what you should actively do to protect your cardiovascular health during sleep. The first highly recommended position is sleeping on your left side. While most people are aware of the basic principle that your heart sits slightly to the left, the full implications for sleep are profound. When you sleep on your left side, gravity aids blood flow, allowing your heart to work less and promoting better circulation and increased oxygen supply to your brain. However, there is an even more critical benefit that has emerged from recent research. Approximately a decade ago, scientists discovered the glymphatic system, which functions as your brain's intricate waste disposal system. During sleep, this system is responsible for flushing out toxins, metabolic waste, and proteins, including those implicated in Alzheimer's disease. Studies published in the Journal of Neuroscience indicate that the glymphatic system operates most efficiently when you sleep on your side, particularly your left side. Every day, your brain accumulates proteins like amyloid beta and tau. In individuals with Alzheimer's, these proteins aggregate to form plaques. In healthy brains, the glymphatic system efficiently clears these substances during sleep. However, if your sleep position hinders this clearance, these proteins can begin to accumulate over years and decades. By the time symptoms of cognitive decline become apparent, significant and irreversible damage may have already occurred. Left-side sleeping optimizes this crucial waste clearance process, serving not only to prevent strokes tonight, but also to safeguard against cognitive decline in the future. Furthermore, for those who suffer from acid reflux, sleeping on your left side can help keep stomach acid down due to the anatomical positioning of your stomach and esophagus, leading to a more comfortable awakening free from chest burning. If you have a lifelong habit of sleeping on your right side or back, transitioning to left side sleeping will require some adjustment. A practical solution is to use a body pillow hugged in front of you. This helps maintain your left side position, supports your spine, and for those experiencing joint pain, placing a smaller pillow between your knees can provide additional comfort. It is natural to roll over during sleep. The objective is not perfection, but rather to maximize the time spent in optimal positions and minimize time spent in detrimental ones. Beyond left-side sleeping, there is a second position that proves highly effective for specific individuals: Back sleeping with gentle elevation. This is not about lying completely flat or sitting upright, but rather adopting a gradual incline that raises your upper body by 15 to 30 degrees. This can be achieved using a wedge pillow, an adjustable bed, or carefully stacked pillows, ensuring that your entire upper torso is elevated, not just your head. This position offers three primary benefits. Firstly, it facilitates more efficient blood return from your lower body to your heart. Individuals experiencing poor circulation, swollen ankles, or varicose veins will find this position beneficial, reducing the workload on their cardiovascular system during sleep. Secondly, it decreases intracranial pressure. For those with fragile brain vessels or uncontrolled blood pressure, this elevation can mitigate the risk of small vessel rupture. While these tiny hemorrhages may not cause dramatic symptoms, their accumulation over time can contribute to cognitive decline, memory issues, and what is medically termed vascular dementia. Thirdly, it improves breathing. By keeping your airway more open, this elevation can reduce snoring and enhance oxygen delivery to your brain, offering relief for individuals with mild sleep apnea, congestion, or sinus problems. A critical detail to remember with this position is to place a small pillow under your knees to maintain the natural curve of your spine and alleviate pressure on your lower back. This combination creates what is often referred to as a zero-gravity posture, a concept studied by NASA for astronauts, which distributes body pressure evenly, reducing strain on joints and blood vessels. However, it is important to note that this position is not universally suitable. Individuals with severe sleep apnea, for instance, might find their airway still collapses even with elevation, making left side sleeping a better alternative. Those with shoulder arthritis may experience relief in this position, and individuals with heart failure often find left side sleeping to be ideal. The key takeaway is to understand the underlying principles of why these positions are beneficial and to apply this knowledge to your unique circumstances rather than adhering to a rule blindly. The quality of your sleep environment plays a crucial role, and even the most optimal sleep position can be undermined by suboptimal bedroom conditions. Your bedroom is more than just a place to sleep. It is where your brain and heart either recuperate or deteriorate. The ideal room temperature for sleep is between 64 and 68 degrees Fahrenheit. A cooler environment helps lower your core body temperature, which is a key trigger for deep sleep. It also naturally reduces nighttime blood pressure, thereby alleviating strain on your brain vessels. Conversely, a room that is too warm forces your body to work harder to regulate its temperature, leading to lighter sleep stages and an elevated heart rate, preventing you from reaching the restorative deep sleep phases essential for healing. Secondly, it is imperative to eliminate blue light exposure after 9 p.m. This includes light from phones, tablets, televisions, and harsh overhead lighting. Blue light suppresses melatonin production, delaying deep sleep and hindering the brain's ability to clear metabolic waste and the cardiovascular system's ability to stabilize. If using electronic devices is unavoidable, opt for blue light blocking glasses or utilize night mode settings. Even better is to read a physical book, allowing your brain the necessary wind down period without the disruptive effects of screens. Thirdly, proper neck support is critical. As previously discussed, the height and contour of your pillow significantly impact spinal alignment and blood flow through the vertebral arteries. A memory foam pillow with a cervical contour can support your neck's natural curve without forcing your head into unnatural angles, thus preventing restricted blood flow. Lastly, noise pollution, even sounds that do not fully awaken you, can disrupt deep sleep, causing spikes in heart rate and cortisol levels. These seemingly minor micro-stress events, though not consciously remembered, do impact your vascular system. Utilizing a white noise machine or earplugs can create a consistent sound backdrop that masks irregular noises, fostering a more peaceful sleep. These recommendations are not optional. They are variables that directly influence your stroke risk. For those seeking to take their nighttime health monitoring a step further, consider tracking your body's signals during sleep. Your body provides valuable information while you rest, but most people are unaware of how to interpret it. One option is an overnight pulse oximeter, a small device that clips onto your finger and measures your blood oxygen levels throughout the night. If your oxygen saturation repeatedly drops below 92%, it is a significant red flag, potentially indicating sleep apnea, poor circulation, or respiratory issues, all of which elevate stroke risk. The data gathered from this device can be invaluable for discussions with your doctor, especially if you experience unexplained morning symptoms. Another valuable tool is heart rate variability, HRV tracking, often available through smartwatches or sleep rings. HRV reflects the functionality of your autonomic nervous system. A low HRV overnight suggests stress, inflammation, blood pressure issues, or metabolic dysfunction, serving as an early warning that your body is not adequately recovering during sleep. Additionally, maintaining a simple sleep journal can be immensely beneficial. Record how you feel each morning, noting any headaches, dizziness, numbness, or tingling, or brain fog. These subtle symptoms can be early indicators of insufficient oxygenation or restricted circulation during sleep. Identifying patterns in your journal entries can help you and your healthcare provider pinpoint issues that might not be apparent during a standard office visit. It is crucial to remember that these monitoring tools are intended for awareness and education purposes only, and do not replace professional medical evaluation. If you notice concerning patterns, persistent symptoms, or have existing stroke risk factors, it is essential to discuss these findings with a qualified healthcare provider. While self-monitoring provides valuable data and a sense of control, it is not a substitute for professional medical care. A critical point to understand is why this vital information about sleep positioning and its impact on cardiovascular health is often overlooked in standard medical settings. Sleep posture does not fit neatly into the typical framework of a medical appointment. There is no blood test, no imaging study, and no prescription that directly addresses it. In a brief 15-minute consultation, doctors are primarily focused on lab results, medication adjustments, and addressing acute symptoms. Sleep posture, unfortunately, falls outside of this immediate checklist. However, burgeoning research is demonstrating that sleeping in certain positions can silently but significantly affect blood flow, oxygen delivery, intracranial pressure, and the brain's ability to clear toxic proteins. These are not dramatic, acute events, but rather cumulative processes that build night after night, year after year. For individuals over 60, or anyone managing blood pressure or cardiovascular conditions, these nightly habits become critically important. The empowering aspect of this information is that you do not require a prescription or expensive treatments to make significant improvements. What you need is awareness and 1 or 2 targeted adjustments. Making a single change, such as shifting to left side sleeping, elevating your head by 15 degrees, stopping your evening meal 2 hours before bed, or switching to a single contoured pillow can measurably enhance your cardiovascular system's function during sleep. This is not merely about reducing stroke risk, it is about investing in long-term brain health, cognitive clarity, and cardiovascular well-being for the next 20 to 30 years. By engaging with this information, you are already more informed than a vast majority of people. You are taking control of variables that are within your power to change. You now possess knowledge that many doctors may not discuss in a standard appointment, information that could genuinely protect your brain starting tonight. This is not a minor advantage, it is profoundly significant. Therefore, today, commit to making one adjustment from the strategies discussed. Perhaps it will be adopting left side sleeping, ensuring you finish dinner 3 hours before bed, or transitioning to a single contoured pillow. Begin with one change and give it a week. Pay close attention to how you feel upon waking. Notice if headaches diminish, if your energy levels improve, or if you feel mentally sharper. Your body will provide feedback on whether the change is working. Finally, take a moment to share your commitment in the comments below. Which habit are you choosing to change first? Your response might prompt someone else to recognize a pattern they hadn't previously considered. If this video has provided you with valuable, new information, please show your appreciation by hitting the like button and sharing it with anyone who could benefit, particularly those over 60 individuals. Managing blood pressure, or anyone experiencing unexplained nighttime symptoms. And for even more impactful health insights, subscribe to the channel right now. Next week, we will reveal 5 specific foods that clinical studies have shown can reduce stroke risk by up to 30%. These are not generic recommendations, but specific foods with precise quantities, and you likely have 3 of them in your kitchen right now, perhaps not using them optimally. This is research that most people will never encounter, information that won't surface in a standard doctor's visit, yet it holds the potential to fundamentally alter your health trajectory. Hit subscribe and turn on notifications, because if this video was valuable, next week's content will be even more essential. Until then, sleep smartly, stay informed, and protect your brain. I'm Dr. Blake Harrison, and I look forward to seeing you in the next video.